Once lauded for keeping the pandemic at bay, Taiwan now sees its medical facilities overwhelmed with COVID-19 cases and medical workers in major hospitals struggling to cope. There's growing concern that the medical system could face collapse as the spike in coronavirus cases peak in the second half of this month. Victoria Jen with this report.
As an emergency room nurse, 40-year-old Yang Hui-ting dreads going to work these days. Since Taiwan abandoned its zero-COVID policy in April, Ms. Yang says her workload has increased tenfold, driving her to the brink.
其实说真的，我们已经崩溃了。我们现在很像行尸走肉，每天就是病人来量血压，问你怎样不舒服，很像那个机器人，你知道吗？完全没有办法用脑袋去思考。现场拿到号码牌的人必须把快筛检体拿在手上。
The island's daily COVID cases have reached record high after it shortened the quarantine period for close contacts of infected patients and dropped contact tracing. And the daily figure could peak later this month to over 100,000 a day, according to the official forecast.
他现在的状况都恨不得自己确诊了，因为这样他可以在家里好好休息。不然就是有一部分的人，他真的身心疲惫到底，他这真的很想要直接离职了，不想做了。
Ms. Yang's frustration is shared by many medical workers at major hospitals, especially in Taipei and New Taipei cities, which are among the hardest hit. Far Eastern Memorial Hospital, for instance, has seen its number of its ER patients soar 8 times in the past month.
那全世界各地的资料都显示，对非确诊者的医疗排挤所产生的伤亡，坦白说会大于确诊者的伤亡，确诊本身造成的伤亡。
确诊医护要休息，确诊医护要休息。
Unions of medical workers took to the street last week to protest against the government's rash decision to ditch the zero-COVID policy. Taiwanese authorities have allegedly failed to maintain consistent supply of COVID-19 self-test kits on the market before announcing the policy shift to live with the virus. And with its ever-changing COVID-19 guidelines confusing the public, many people flock to major hospitals to take PCR tests instead of doing self-tests at home. With resources stretched to the limit, many severely ill patients are not receiving the due medical care.
派出一个比较有效的方式去做分类，而不是说现在这样子。现在这样子真的是很乱。他要有很有 power 的说，我的减3分级就是1、2级就是往大医院送，3、4、5级麻烦到基层医院去看诊。
The unions now demand the health ministry to deploy extra manpower at hospitals, hoping to ease the current overload.
卫福部的解决方式竟然是依照医疗机构标准扩大照护比，从1:5变成1:9到15。请问这样的高护病比是要让我们护理人员做到死吗？
Despite strong resistance from the frontline medical workers, health authorities are pressing ahead with its new strategy, insisting the medical system is far from its full capacity. Meanwhile, more PCR drive-through testing sites are set up to ease the COVID testing workload at hospitals.
这最后一站，大家把它撑过去，让社会能够更安全，我想是一个很大的贡献。那我们当然还是津贴啦、奖励啦，这些我们都还是会继续编预算的来执行。
So far, 99.7% infections are either mild or asymptomatic cases. More than 80% of the island's population has received their second shot of vaccine, and over 60% has been given their booster shots. With an extremely low fatality rate of 0.2%, the minister plans to remove more COVID restrictions in the coming months and possibly reopen its borders in July. The unions are not ruling out a strike next month if the manpower crunch does not improve soon. Victoria Jen, CNA, Taipei.